On this episode of the ASC Podcast with John Goehle, we mourn the loss of a dear friend to the ASC industry. We review annual education requirements and interview Steve Gallion, the CEO of Medtrainer, about online education. Welcome to the ASC Podcast with John Goehle, a podcast for anyone interested in the freestanding ambulatory surgery industry. This episode is sponsored by Medtrainer, one of the nation's leading providers of online education. For more information, please visit medtrainer.com. Welcome to episode 80 of the ASC Podcast with John Goehle for December 30th, 2019, recording from our studio in Spencerport, New York. This is Sue Cronkite, Senior Nurse Consultant with AHS, and I'm here with John Goehle. John is recognized as one of the nation's leading experts in all aspects of the ambulatory surgery industry. The author of the major books about the industry and the owner of Ambulatory Healthcare Strategies, the industry leader in ASC regulatory and accreditation, governance, and quality improvement oversight. John speaks frequently at both national and state ASC meetings on a wide variety of topics.
Well, we had a little bit of excitement just before we pushed the record button.
Yeah, that really woke me up. We were sitting here starting to record, and I saw a gray thing run by my foot. I knew it was bigger than a mouse, but I didn't know what it was.
It was this adorable baby squirrel who somehow it's gotten into. Our studio's on the ground floor of the home here, and we live in a forest, so it's
we got all kinds of things.
Unfortunately, we have a lot of visitors. Usually, this is the first time I've ever had something like a squirrel, though. So we scared him away. I don't think he's completely left, so we'll have to ask our exterminator friend to see what he can do about that.
But transplant him.
Yes. So here we are just after Christmas, just before New Year, recording on the 30th, and it was a pretty good Christmas, except for the fact that you and I were quite sick much of it.
We probably still sound that way. I think your voice actually seems pretty good.
Yeah, it's getting
mine still
better.
Seems a little stuffy, but we're feeling a lot better.
That's right. I think, when you are empty nesters like we are, there's all this excitement prior to Christmas, and then on Christmas Day, it was just the two of us. Not that wasn't bad, but everybody had gone somewhere, and we're just sitting around. I don't think we got out of pajamas all day long.
We had my family over, and my grandsons opened their presents, and then we went over to your family's for the Christmas Eve. So Christmas Day, we just it was relaxing, but almost kind of a letdown.
I know.
And plus not feeling well.
It has been hard to get back to work today, though, on the first Monday after Christmas, but it's a short week, so I guess it won't be so bad. So things have been kind of quiet in the ASC industry, as we expect at the end of the year. Then, of course, when the new year comes, things tend to move very quickly.
We're going to knock on wood.
Knock on wood, right. We do have some quite sad news to pass on. A couple hours before we recorded this, we heard that Randy Leffler, who is the executive director of the Ohio Association of Ambulatory Surgery Centers, passed away on December 23rd. And he was a dear friend of mine, a dear friend to the industry, a dear friend to everyone in the state of Ohio that's involved in the ambulatory surgery industry. So
such a nice guy. I don't know how old his son was, but
we'll put a link to the obituary and some information if anybody wants to pass on their condolences. But it is a sad day for the industry, and we will miss you, Randy. So moving on to another interesting issue right now. We've talked about USP 800 considerably, but we haven't really given you a lot of advice yet on it. And I would like to be able to say, as we're sitting here, that we have advice for you. But all of our consultants that give us information about what to do about USP 800 are giving us contradictory information. So I can't go on the air here and state what to do other than to say, this is serious. What's going on with USP 800? And for anybody that is not familiar with it, please refer to some of our previous episodes, and we'll put some links on.
But it's basically that mitomycin that tends to be the issue in the ambulatory surgery space.
Right.
So if you have that, I know it's so frustrating to say you can't ignore it, but we can't really tell you what to do.
So I think the most important thing for you to deal with right now is talk to your pharmacy consultant about it. You're going to need to do a risk assessment at the very least. And then once you get some advice that you trust from your pharmacy consultant, implement that. I think at this point, We have been checking with the accreditation organizations who have not given us any advice yet on how to handle it. I, as a surveyor, have not been given any guidance yet. So I don't think this is an imminent issue, but of course there could be some significant ramifications for organizations if OSHA were to start enforcing these requirements. So I know this sounds a little wishy-washy right now, but we really don't have anything else to say on this other than, to stay tuned. Talk to your own pharmacy consultant. We're going to try to circle back with some of the people that we've talked to on previous episodes here and see if they can give us some advice, maybe get them on the episode. So again, the most important takeaway here is that if you are an eye surgery center that uses mitomycin, you definitely need to consult with your pharmacy consultant immediately and get some advice, do a risk assessment as to how to handle it, and implement whatever precautions they have given you. And as we get more information, official information, we'll pass it on to you.
I know in the past we've talked about drug shortages and all the problems that they've caused. And I noticed on the FDA website they were talking about considering a rating system for quality and dependability in drug manufacturing that would allow purchasers to choose to support manufacturers or suppliers who have committed to maintaining quality and a consistent supply of those medications. So it would be a different factor than just the cost, which of course is important. But the shortages they found to be caused by many factors, about 62% have been caused by quality issues. The 18% is just unknown. Increased demand accounts for 12% of the shortages. Natural disasters, which is what we tend to hear a lot about, are only 5%, and product discontinuation is 3%. So if they can get people supporting and really striving to have that good quality maintained, that could really make a huge dent in this. So we'll keep an eye on that. And you can go to the FDA website and just see how that's progressing.
And we'll put a link on our webpage for that too.
And just an update on that New Jersey ambulatory surgery center that had the issue before where they had a bad survey that showed they weren't following other infection control guidelines. And they had to notify 4,000 patients that were treated in a certain time period of the possibility of having been exposed to hepatitis or HIV, among other things. A New Jersey judge has granted a motion for a class action suit against the surgery center, and that involves 400 of the possible 4,000 patients who were treated at the center during that time period in question. They're currently asking to have a second blood test covered by the center, which is important due to the long incubation period of some of the infectious diseases such as HIV. That first test could very well, if it came back negative, may not be accurate enough. They're open to any other action in the future. No infections have been found to be attributed to the issues at the center, but many of the patients haven't even been tested. So that kind of relates to what we're talking about coming up. The state had found that the center's most current infection control plan was dated back in 2010, and it still had the name of the previous facility, which had used the same building and had preceded this ASC that we are discussing. No point in mentioning the name, but so it's just important to stay up on all of your education, on your infection control plans, risk assessments, all that stuff. It has to really be a current, I don't know if you want to say living, breathing document, but really make it part of your culture and part of your education, and always keep up to date on it. Don't just have it there as a piece of paper so you can point to it during a survey. Right.
And I don't know of a situation where an infection control plan shouldn't have even minor modifications every year. There's always things that we're learning. You might be a growing organization that has made changes in the equipment you're using, the services that you're providing, the people that are providing them, the level of people that you're providing them. So these programs need to be updated. And as you said, Sue, it really comes down to education. A lot of the demands on ambulatory healthcare strategies time lately has been developing educational programs for our clients, doing the education, doing re-education, doing competencies. It's becoming a really big issue right now. And, people are really trying to stay on top of it. And it's very difficult for, nurse managers to keep on top of all of these things alone. So, yeah, absolutely. And, of course, in our second segment, we're going to talk about that. So let's take a break, and we'll come back and we'll talk about the various things surrounding educational programs in ambulatory surgery centers, the differences between mandatory education and in-services. And we're also going to talk a little bit about online education programs, which I know a lot of people have questions about. So let's take a break.
Steady and consistent compliance training and continuing education for your ASC staff, surgeons, and nurses can be daunting. Multiple learning needs across various subject matters for several individuals is required to stay accredited and compliant. Managing all these trainings can be even more challenging. Luckily, there's a platform that makes the learning process on all levels streamlined, easy to access, assign, and certify, and that platform is Medtrainer, the all-in-one advanced learning and continuing education platform that allows administrators to assign and easily manage training programs for their ASC. With over 240 unique and robust training courses, videos, interactive, and easy-to-complete modules, Medtrainer provides the tools, the materials, and the depth of knowledge needed to become and stay compliant. When new and notable federal and state regulatory requirements are implemented, Medtrainer's team of compliance and regulatory affairs experts immediately get to work revising and updating training modules, bringing them current to reflect the new changes, or create brand new content and provide it on the platform promptly for our ASC customers to quickly get caught up. Not only does Medtrainer provide award-winning compliance training, there are other management tools available, accessible from any connected device, that store policies and procedures, manage contractual obligations to payers, log equipment maintenance, incident reporting, disaster preparedness, and even a dedicated accreditation tool with Accredibility, all built into one easy-to-use platform. Take control of your ASC's training and continued education. Take back the time you spend gathering learning materials and printing them out or emailing them one by one to your staff. Monitor your staff's training by setting due dates and get automatically notified when courses are due or if they lapse. Medtrainer, your all-in-one solution for compliance training and continuing education. Visit medtrainer.com to schedule a free demonstration and see firsthand how Medtrainer will help your ASC in compliance, and to learn about our new accreditation management service, Accredibility, designed exclusively for ambulatory surgery centers.
So I thought we would talk about education in this episode. And John, there's two main parts to the education program. There's the orientation and then the annual mandatory education.
Correct. And actually, there's a third part, which would be, which I would refer to as in-services. And unfortunately, sometimes organizations really mix these terminologies up. So let's be very specific that, orientation is what's required to be done within 30 days. Now, I know you're given 30 days to educate people, but you really cannot let them start operating in your facility until they've been given the most basic information. And some of that basic information is about emergency preparedness, how to handle a transfer, what to do in case of an emergency, obviously an orientation to the equipment, the supplies, et cetera. So
patient care, and also how to protect themselves if something, fire training, if something,
right.
Knowing where all the exits are, just all that basic stuff that if anything happens, that they can get out safely, they know what to do.
That's right. And I think for many of our listeners, they're going to listen to us saying this and think, well, of course we're going to do that. You would be shocked at how many people or how many centers out there, the doctor says, hey, hire Sue so that she can start working here, and I want her operating this afternoon. And, people just roll over and say, okay, I'll let them do it. And they think, well, she's been working in an operating room for 35 years. She knows Dr. Smith. She won't have any problems. Well, that's not safe, and it's not fair to her either. She's not going to know the equipment. She's not going to know the setup, and she's certainly not going to be able to understand what to do in the case of an emergency. So that's one type. That's the orientation within 30 days. The second is that many of these same items have to be retrained on an annual basis. So it's important for you to understand that just after that 30-day orientation, on an annual basis, you're going to make sure everybody is re-educated in a number of very important areas. And we're going to kind of list some of those areas, just kind of give a laundry list of items that probably should be included in your orientation program. We will post a list of it on the website too. And then that third part that I talked about is the in-services. And what I find sometimes when I'm doing a mock survey or doing a survey is that when I ask about their annual training, people say, oh, yeah, we have regular in-services every couple of weeks. And that's not what I'm talking about. In-services are things that you provide to educate your staff on things that are new to your organization or where they need additional training, or if you're just updating them on various aspects of that operation. And in service, that if we start using the proper terminology here, orientation, annual, mandatory, and in services, then everybody will be speaking the same language.
So specifically, what would that be if you have a new piece of equipment?
Well, to give some examples, let's say that as part of your hand hygiene surveillance, you find out that your employees are not following hand hygiene, policies. I know, shocking.
I was going to say, but I didn't.
But now, is anybody going to say, well, we've never done any training on it? Of course you have. It's part of your annual mandatory. It's part of your orientation. But periodically, you're going to have to educate them on additional techniques or give them more education or reminders. That would be that in service. As you said, you buy a new piece of equipment, a brand new phaco machine. You decide to bring the vendor in. Now, remember, the rule here is that it's not the vendor that is teaching your staff on how to use the equipment. That vendor is teaching somebody how to use the equipment, and that person is going to be doing the ongoing training. That is an important principle under accreditation, especially AAAC, is that we use the concept of train the trainer. You should never be in a situation where you're totally reliant on the vendor for education of your equipment. So when that vendor comes in, there needs to be somebody that listens and pays enough attention to what's going on that they can then go on and train other staff on how to do it.
Okay, so he can train 10 of your staff or anything, that's fine. But then you carry it on, and if somebody comes back to you, you have to be able to give those answers.
That's exactly right. Right. Now, is a person in your organization going to be able to do as good a job as a vendor? Probably not. But you need to have somebody that's skilled enough in your operation, that understands the equipment well enough, that they don't rely on that vendor who's not going to be there every day to provide the ongoing educational needs of that organization, or if something goes wrong. So that's a very important principle there. So let's talk about some of the regulatory requirements here. And that CMS, as we mentioned, and the accreditation organizations do require training within 30 days. States might have additional training requirements in addition to those that are levied by CMS and the accreditation organization. And then other federal requirements are in place. For example, OSHA, has very specific training requirements for bloodborne pathogens, as well as the general OSHA requirements. HIPAA requirements are another regulatory agencies. So it's not just CMS that you're going to have to keep an eye on. Now, I just wanted to kind of go through a laundry list of a number of the types of trainings that you should be doing as part of orientation. And let's just kind of point out that anything that you train everybody on at orientation, they should probably be reminded of that on an annual basis also. So here are just a laundry list of the various things that you should be training your staff on at orientation and every year thereafter. So I tend to break the list into three broad categories: general education, review of the plans in the organization, and review of specific policies. So the general education is going to include the following: HIPAA training, basic radiation safety training if that's applicable, how to use safety data sheets, OSHA safety, that's general safety, workplace violence, OSHA bloodborne pathogens and sharp safety, personal protective equipment, emergency preparedness, pain management, child, elder, and domestic abuse, sexual harassment. And then depending upon your state, you might have some additional training such as LGBTQ+, or human trafficking. Now, the second section is the review of the various plans. So your employees and your staff and providers need to be aware of your corporate compliance plan, your quality improvement plan, your peer review process, your infection and exposure control plan, your emergency plan, and your safety program. And then the last section is kind of a list of all the policies that you should be reviewing with your staff on an annual basis, and that's the following: disruptive behavior and workplace conduct, impaired and incapacitated provider, patient rights and responsibilities, patient privacy notice, HIPAA privacy and HIPAA security policies, advanced directives, abbreviation policy, timeout process, H&P requirements, completion of medical records, abuse and harassment, including mandatory state reporting, guidelines for admission, Code Blue policy, patient transfer process, adverse incident reporting process, the grievance policy, and pharmacy policy.
Wow, that's a long list.
Yes, and admittedly, not all of those things would necessarily have to be done on an annual basis, but you're going to have to show proof that everybody has this training. And if you put together a really good educational program, we tend to do this education in about 3 to 4 hours, depending upon the staff that are there and depending on how many questions we get. And of course, assuming staff that has been through this before. I mean, if you're talking brand new staff that doesn't even understand HIPAA, that's going to be an entire day process here. So that's a pretty comprehensive list. We'll post a copy of that recommended list for us. Now, I say this, you could probably make do with less. What we like to say in our company is we just feel it's important to have all these this information out there. We tend to put it into a binder, an educational binder, which people have access to throughout the year. And, surveyors love to see these comprehensive educational programs that we've developed here, and we pass with flying colors when they look at what we have made available to our clients.
And what responsibility does the governing body have for education?
And of course,
everything else.
That's right. Exactly. We just set that up. Yeah. I mean, the governing body is responsible for everything in the organization. So, and one of those things is certainly making sure that there's an educational program available, that you approve of it, that the administration has evaluated all the needs of the organization and the staff and has developed an appropriate program. So that does lead to the next question is who in your organization is required to have orientation and mandatory education? And the answer, quite simply, is everybody. And this is going to raise some eyebrows because I've actually been giving speeches where I've gotten into disagreements with attendees who have argued that that the physicians don't need to have this training. And they want me to point to a specific standard or regulation that requires it. And what I point out is that anytime that they're referring to the term staff in the regulations or accreditation standards, they don't differentiate as to whether that staff is referring to a physician or an employee or anybody else that works there. So, and it stands to reason that all of your employees are going to have to go through this training, but certainly the providers are going to have some level of training in all these areas. They need to know about the emergency plan. They need to know about the peer review program. They need to know about the quality improvement program. They need to know what to do in the event of an emergency, a transfer, et cetera, code blue. So all of those things need to be provided to them in some educational format. Most of our clients put together a nice binder with all this information. And then the administrator usually sits down over coffee or at the end of the day or whatever in order to be able to go through this with the doctor. And it usually is a pretty smooth process. Make sure, obviously, that you get them to sign off on it. Now, they're not going to be happy about doing this. I know that. But you do have to provide proof that that type of education is occurring. And it's important that you put together some documentation to that effect. And as I said, what we tend to do is we have two binders for educational program. Many of our clients. One is for the employees, which is the most comprehensive one, and one is for the staff. Now, many of our centers just decide to use the same for both the providers and for the employees, and that's fine, of course. So, the simple answer is everybody needs to go through orientation and annual mandatory education.
So let's talk about the different ways to present the education program. The 3 ways are in person, which, of course, we prefer the most.
Right.
Online, or just handing them the book to look at. And, of course, you can do combinations of those, which often works the best. That's right.
I think we all agree that providing in-person training is by far the best. It provides the most interaction. It provides the opportunity for you to, especially when you're doing training with other people. We do this a lot in the company. I know, Sue, I've actually attended a couple of the training sessions you've done. You've attended some that I've done. And we enjoy them because there's so much interaction with the staff. And, if you prompt questions, if you prompt them to kind of give you feedback, you can see whether they're comprehending what you're talking about.
And there are some educational components that require you to be available to answer questions.
That's correct. There are 2 in particular, and that is, and this is a very important thing to remember, is that when you're presenting bloodborne pathogen training, there has to be an opportunity for the attendees to ask questions. And of course, you can't do that on a computer program. You can't do that in a book. You're going to have to provide that opportunity. Now, you can still provide all that education in one form and then make sure that somebody that is competent or trained in bloodborne pathogens then gives the employee the opportunity opportunity to ask questions here and then document that opportunity. Online training is kind of the new wave. I guess it's not terribly new anymore. We're going to have an interview later in this section here where we talk to Medtrainer about their online educational product. And of course, it's probably the wave of the future. We have to recognize that there are some inherent limitations to online training, especially those that are developed, for a mass audience. And that's why, as you'll see in the interview that we talk about all the things that you need to do in order to make sure that you're really doing the right things when you're putting together an online program. Online programs are not something where you just hire it out to somebody and have them do it all. That's a very quick way to fail a survey.
Yeah, but it can be a good supplement.
Absolutely.
Don't you think even in a binder, having a book to hand somebody they can look over. So I think all these things combined, especially when you think about how different people learn.
Right.
Some people learn better by reading. Some people learn better being able to be in a quieter spot and maybe watching something on the computer. And some people learn better in a group. So, I think all these methods are pretty valid.
And then the last one is the one that many of our clients, if not most of our clients, do, and that is we prepare a annual educational binder, which is broken down into all the various categories that we mentioned earlier. And then that binder is given to the employee. And, so upon orientation, the nurse manager would sit down with the new employee and go through that binder. They won't spend the entire time with them during that orientation, but they'll come back periodically and say, how are you doing? It'll usually take the employee, a day to go through the binder and all the contents there. And then they have to take a test or a quiz, shall we say, as they're going through it to assess their comprehension here. And then we usually present that binder in two formats. One is in a PDF format that the employees, can look at online, and also a physical document. And then make sure that this document is capped so that you can provide it as proof for surveyors that you've provided this education, and have the employees fill out a checklist that has a list of all of the items that they were trained on. So that brings up the next section, which is how do you assess comprehension? And this is one of those areas. Before we started doing the testing in our company is about 3 years old now. And prior to that, we had a survey where, employees had actually said to a surveyor that when asked about the education, said, "Oh, I don't remember ever getting any education, in the form of a binder here." And of course, we're all looking at each other saying, what did we do that first day that they were hired here? So we had no proof other than them signing off a checklist, which they seem to have just done. And so that's when we had them start taking a test. And that's proven to be very beneficial. And it's a very good way. If the test is organized appropriately, it can really do a good job of making sure that they've spent some time going through the content and understand it and comprehend what's going on.
Yeah, so it doesn't have to be difficult. Just something to make them focus a little bit more. Even just the act of writing something down sometimes just kind of embeds it in your mind a little bit better.
That's right. So if our audience hasn't gotten the hint yet, this is a very important element of your ongoing operations, is making sure that you're training your employees on a regular basis on all of those things they need to understand in order to operate in an ambulatory surgery center.
I know you've already covered some of this, but as a surveyor, what do you look for?
So the most important thing is that we have documentation that the employees have had their orientation initially and on an ongoing basis. And one of the frustrations that I have as a surveyor, and I've mentioned this before, is that it's difficult to assess that when the educational records are all over the place. So it really is very smart for orientation that you have one document that lists all of those things with dates next to it as to when that training was done and like initials as to who did the training, et cetera. So it's a very good thing to do is to have that one single sheet of paper, and you can keep it in two spots. One spot should be in the employee file, and another spot, if you wish, is to keep it in a comprehensive binder so that the person that's in charge of making sure all the education is done can go through it and make sure everybody has had their regular educational training needs met. So that's the first thing. The second thing is we want to assess what is being trained and who is being trained. So we're going to definitely look for that education being done for the employees, for all of your credential providers, And, if you have volunteers, we have one organization, for example, that has volunteers. So you're going to want to see all the volunteers have had training also. Anybody that comes into your facility and provides any type of service is going to have to go through some type of an orientation and educational program here. And again, also you're going to want to make sure that you have the documentation on an annual basis. And then we're going to want to see that there's and then the other thing that we're going to do is we're going to ask questions of the staff. Because, we're going to know that you said that they had this training, but we're going to go up to them and we'll probably pick some of the newer employees too and say, can you describe what your orientation was like? Or what did you cover during your last mandatory educational program? Or what was your annual fire in service? How was performed? So, good surveyors are obviously going to be, not only assessing what is down on paper, but, what the reaction of the employees are.
Let's pull it all together and talk about how you report that and record all of that.
So as we mentioned at the very beginning of this section, we talked about how the governing body is ultimately responsible for this, which means that there better be something in the governing body minutes that reflect the fact that they've seen the educational program and know that it's occurring.
And they approved it.
Right. I usually start, as we all know, with the quality improvement program. So part of your quarterly quality improvement minutes should be a statement in there as a status of your orientation program and your annual mandatory education. And what we usually do is we'll have a section for education, and then we'll say orientation, and we'll just say under that, 3 new employees oriented during the month of February. And then under the mandatory education section, we'll say the mandatory education program was presented on February 23rd to all the staff. Or, if people are going through a binder process, we'll say, well, they started doing all of this on February 23rd, and all of it is expected to be completed by the end of the first quarter. So in that way, you're giving some responsibility to the Quality Improvement Committee for overseeing what's going on and documenting that through. And then, of course, each of those things should be reported up through the various committees until it gets to the governing body. It doesn't have to be in detail when it gets to the governing body. It just needs to say that, everything in the educational program is up to date. Now, the next thing we want to talk about is online education. Online education provides us an incredible opportunity to provide high-quality educational programs that we couldn't usually develop in-house in most of our organizations. And there's, a number of companies out there, including Medtrainer, who is the sponsor of this episode and who we interviewed for this episode, put together very professional programs with a lot of research behind it. And what I wanted in this interview is to kind of talk through how those programs are different than things that you might develop in-house, how they can really enhance the educational program. And we also talked during the interview about the good feedback mechanisms that you would develop in there. So let's listen to this interview with Steve Gallion at Medtrainer. So I have with me today Steve Gallion, who's the Chief Executive Officer for Medtrainer. Welcome, Steve.
Thanks, John. Happy to be here.
Steve, in this episode, we're talking about education, and especially as we're coming toward the end of the year and starting a new year, it's time, of course, for organizations to start thinking about their educational programs for the next year. And in particular, we're talking about online education. We're talking about annual mandatory, and we're talking about orientation. So online education modules are becoming much more popular, and they're actually becoming quite cost-effective for the ASC setting. Can you talk a little bit about what the advantages are for an ambulatory surgery center to use online educational venues?
Sure. So online education is not necessarily a new thing, and there's quite a few benefits, not only in the ambulatory surgical environment, but just really cross-industry and cross multiple segments of different industries. There is noticeable why, from a time-saving perspective, you're able to often obtain higher levels of subject matter expertise trainings because you have folks like ourselves who are dedicated to creating educational content towards different segments. And then the overall scalability of training as well. If you have new hires or you have turnover throughout the year, you're not setting aside time and burning multiple hours of human capital resources, from an administrative standpoint as well as a new employee standpoint in order to ramp a new employee. And finally, I would say just the overall flexibility of location. We're not tied down to a specific meeting room or doing a lunch and learn in a certain place. Although there are times and places for that type of training, a lot of the training today can be done remotely, and that makes it a lot more effective and with especially as organizations get larger in their staff size and overall staff population.
So education comes in many different forms. We know that when we hire a new employee, we have to have orientation for that individual, and CMS and the accreditation organizations usually require that all that education be accomplished within 30 days of the hire date. And then we also have annual mandatory education. Can we talk a little bit about the differences between the types of education that you would have between orientation and annual mandatory?
So annual mandatory, oftentimes we're talking about things that are across the entire spectrum of whatever segment or industry you're looking at. So specifically to ASCs and healthcare, we're going to have different governing bodies, whether they're OSHA, CMS, HHS, and then different levels of, let's say, required mandatory education required by accrediting bodies as well. Whereas when you're thinking about orientation, it may be more specific to the org itself, things that are going to require an employee to be introduced to the organization, maybe the org chart, who their management is, different types of trainings that may be more in servicing, which we'll talk about a little bit later, and something a little more practical to their actual job applications and performance within a specific location. A good kind of example of where those two bridge or come together would be taking a mandatory training like fire safety, and then the new orientation training component of that would be the much more specific components, like where are the fire exits, what are the evacuation routes, where are the fire extinguishers, how do we check those extinguishers, who are our vendors that are associated with those. Although we can cover the mandatory training aspect with a more broad stroke training, there's a much higher level of specificity that needs to be addressed when it comes to the orientation message.
Yeah, because the employee doesn't know anything about the company at that point. You're making that assumption.
Yeah, that's correct. And a lot of times you're looking at organizations, both small and large, that are blending both of these, which is completely fine. It just requires a little bit more work on the administrative side. So if somebody goes down the road of looking at online education components, oftentimes it's equally as important to make sure that they're able to customize or create a custom education that they can downline to their employees that cover those more specific topics or things that are specific to their organization particularly.
So one of the things that I note a lot when I do surveys, as you know, I'm a surveyor with one of the accrediting organizations, is that we sometimes have a problem with terminology. For example, I often see organizations use the term in-services when they're really talking about the ongoing education. So let's kind of talk about that for a second. What is the difference between annual mandatory education and the in-services that are offered throughout the year?
Yeah, that's a great question. And there's, once again, a situation where some of these things become a little blended. But I think the easiest way, if you're just looking at it from purely what is online education or mandatory training versus in-servicing, and just drawing kind of a hard line, the easy way to think about that, one is going to be more of the particular hands-on in-job function. So when you're talking about in-servicing, think about things like, you have an employee who needs to be trained on a specific job role or function that's going to be specific to your center, or maybe a specific piece of equipment, something that is going to be more of a hands-on practical assessment. Whereas the online training is going to be, once again, back to more of that accomplishing different regulatory oversight functions. So you're more of your I don't want to say basics, because life safety and occupational health are very, very important, but things like your OSHA standards and your trainings around HHS or CMS standards, which are going to be more of those oversight type trainings, which become mandatory. The in-servicing might be specific to pieces of equipment or actual job function.
Or new services that you might be offering. Or I guess another area that we find a lot is that we might provide ongoing education in hand hygiene as part of our annual mandatory, but then we find that wasn't enough and we have to do some additional training. That would be an in-service, that additional training that we add.
Yeah, and hand hygiene may be a great example of that. So we can accomplish a lot of hand hygiene training online, but when you get into, let's say, the surgery center, and as hand hygiene plays into your infection control, infection prevention programs, there a specific in-servicing on even provided by, whether it's provided by vendors or in-house by administrators on, I'll use an example that I've seen at a surgery center, that something as simple as like a timer of when you're scrubbing up for a surgery, really just walking somebody through the particulars of how to wash your hands and really doing an in-servicing on the equipment that's being used and the purpose of that to complement your hand hygiene program. I mean, that can be equally, if not more important than just checking the box for the mandatory regulatory oversight.
Right. So one of the advantages, as you mentioned earlier about online education, is that it strips away the need to do it in a specific place and at a specific time. So let's talk about that for a second. What is the best way to have staff do online education? Of course, this will vary by organization, but let's just talk, or why don't you just talk a little bit about the different ways that online education can help you be more efficient in your operation by changing that the location and the time.
Yeah, it really, really can be effective on the side of, not being tied to a certain computer or a certain desk at a certain location with regards to flexibility on training. There are pros and cons to this, and you'll need to look at kind of where employees or whoever is accomplishing the training, even in some cases contractors as well, how that they are set up with your human resource department. I won't be able to speak to that across the board because by state and some federal guidelines will kind of govern there. But in many cases, mandatory type trainings can be accomplished from home as well as from the office, as long as there are competency reviews that can prove that that person had participated in that actual training. So there has to be a kind of a real proof of record. So they're not just skipping to the end and kind of getting a certificate for doing nothing or just checking that box. One, but two, there's also a compensation component there. So in most job functions and roles where organizations are going to be required to compensate employees for the time that they've spent to fulfill mandatory trainings. Things that are non-mandatory, let's say continuing education that may be offered, or some type of skill enhancement that benefits the employee but is not core to their job or mandatory for their role. That usually falls into a bucket that does not have to be compensated for. So those are kind of two big differentials because they're getting something out of that training and walking away with more than they had going into it. And it's purely as long as it's optional, usually that doesn't have to be compensated for. But we see most folks, because of the compensation factor, carving out time at the actual workplace to accomplish the mandatory trainings. But administrators, salaried employees, people who are not maybe, in the rank and file employment.
Right. Or are compensated by hour. Right. Yeah. Compensated by hour. Anyone who's kind of exempt from that hourly, it becomes very convenient, especially when you have somebody who's participating in, let's say, a certification like CAPE or something where it's an administrative education. A lot of times the administrators within the surgery centers don't have time to fulfill those types of trainings on site. Their role is a little bit bigger than an hourly employee. And so the flexibility of them being able to accomplish that outside of the workplace and gives them access to the education and them still be effective and efficient in their job while they're at the surgery center. Let's talk about testing for comprehension. In other words, as you mentioned, and I think we've all known about these situations where people just start up the educational program online and then just click the button and go through and then press the button at the end, and then you can get yourself into trouble, especially if they're not really paying attention to the content. So there really is a movement towards some type of testing for comprehension. Can we talk a little bit about the different types of testing that can be done and how that fits into the overall educational role that we have with online education? Yeah,
and that is a pretty big problem in the learning space in general. So you have a lot of people who will try to bypass the responsibilities from training by simply moving to the end and trying to guess against the quiz at the end of the course until they get all the right answers, and a trial and error method there. But as you take a more advanced approach to instructional design, here in our organization, as well as other companies, we have an instructional design department with about 25 folks here that specifically went to school and obtained certificates and certifications in designing online educational learning modules that you're never able to 100% avoid somebody who wants to cheat the system, but it's more of what we call in the industry kind of a forced learning model, where it doesn't allow you to just kind of skip around at your own leisure, right? And so the ways, some of the tools that are deployed and things that you do for learning comprehension are implementing smaller bite-sized segments of learning. So as opposed to doing an hour training and then you have let's say a test at the end of 50 questions, often you'll have the learner wobble out in terms of their attention span, in terms of their retention from the beginning of the module. It's often better to break things up into smaller segments. So I know here at Medtrainer, we tend to break things up into anywhere from 5 to 15-minute segments. And then we wrap those segments with different types of exercises, whether they're scenario-based or there may be a quiz or a small interaction, case studies that may pop up that we need to go through. And mixing and matching those different comprehension type measures allow for us to retain learner engagement. We progress through a course. So as education online has evolved, there has been kind of two schools of thought. People have tried to make things that are heavily gamified, more of like literally feeling like a video game. We have found that sometimes that takes away from the actual content. People start concentrating more on kind of the skill-based portion of the learning as opposed to the learning comprehension. And so we do try to maintain different comprehension that are more standard around like the quiz, case studies, scenarios, but effective, where you still have the learner maintaining the recall that they're going to need through the course in order to really walk away with substance from that training.
So listeners of the ASC Podcast with John Goehle will note that if you are going for AEU credits, we are using that model here where, we give the name of the episode, and the content that will be in the episode, and then at the end of each quarter, you take a short quiz in order to determine that you actually did learn content. And we're very careful, just like you are at Medtrainer, to make sure that those questions are not easily answered without actually listening to the podcast, in our case, itself. So, very good point. And, again, that's something that, I think should be used for any educational program that you develop, whether you're doing it online or in person. I've realized over the years that, so often people just skip through all that material. And then when a surveyor comes in and asks a question, those employees are not able to answer those questions without, going back to the educational module and making sure that they learned what they needed to learn. So comprehension, some type of tool for comprehension needs to be done, no matter the mechanism that you use for providing that education.
And John, one more note on that. We've seen a tremendous amount of success when it comes down to trainings that are, let's just use, we were talking about hand hygiene earlier, really diving into case studies with scenario-based learning. It can be a interactive but still serious way for learners to educate themselves online, but feel more like they are approaching learning from the lens of somebody who has shared that experience. So if they're watching a scenario about a nurse that is in the OR and maybe how they're approaching hand hygiene, what steps are they taking? Here's the scenario. Here's the patient, what type of surgery is happening, and then taking those different steps to make sure that they're covering the hand hygiene and infection prevention protocols. It can put them in the shoes of the scenario, which oftentimes they're a lot more inclined to remember and have that level of recall when they're facing that in their daily job function. So that's a really popular way for us to embed competency within courses outside of the actual check the box, true, false, multiple choice questions.
Right. Excellent. So, Steve, one of the challenges that I have as a surveyor is when I'm tasked with looking at the employee files or the credential files. And by the way, good point that I should make here is that when we're talking education, we're not just talking education of employees, but credential providers also have to go through education, very basic education sometimes in an organization. So we're not just talking about employees here, even though that is the vast majority of the work that we see. But your providers in your organization also have to have this education. But so I just came off of a mock survey last week, and one of the big issues that we ran into is the documentation of the educational programming. And in their case, they had a mix of online education and education that was provided either through in-services or through the annual mandatory in-person training. So I think one of the advantages of doing the online training is the fact that documentation is usually a part of that. Can you speak a little bit to what are the expectations? What should our listeners expect if they are going to go to an online educational tool in terms of reporting, and what should they be printing out and putting, and where should that be put?
This is a common challenge outside of the ASC space as well, just across healthcare. And there's a couple different ways to look at this. If you really want to err on the side of caution, it's important to choose a learning provider that has a functionality for you to store and manage outside credentials and certifications, as well as learning that is accomplished through the system. And so let me break that down a little bit. Within the Medtrainer system and several other learning management systems out there that are good, will allow you to upload, let's say, a scan or a photo or some type of documentation of a completion of a training that you took, let's say, in person. Maybe you went to a seminar or you were at a conference and had some type of a takeaway from there. Storing that within the online platform itself is a good way to help fully manage all your credentials. So if I was advising a ASC administrator with, let's say, 20 employees total and X amount of providers, it doesn't really matter, I would tell them and make it a cultural thing within the organization to ask for those documentations after anybody has completed that training and start storing that within the online system. Having that core single primary, sole system of truth and record of truth is super important. And so you're not scrambling at the last minute during a survey or an inspection. The only big differentiator that I can think of is going to come down to different trainings that may be commingled with, let's say, HR records. We want to be careful not to be commingling human resource records into the learning management system. And that's kind of the disadvantage of that store everything online. There are some regulations that require human resource records to be separated from the training records. And that's also can be varied state by state, but you'll want to check to make sure how you should be properly storing those records. I like the functionality of being able to run a report backed up by individual certificates inside of systems. And what I mean by that is if you're a surveyor coming into my facility and you say, Steve, I need to see your training for X, Y, and Z. I give you a high level, kind of like a skyline report of all the trainings, when they took place, by title, by employee. And then it's pretty common that the surveyor would ask or spot check, say, I want to see the actual certificates of competence, or even the pass rates or the competency. How many times did this person take this exam and what passage rate did they have? And kind of spot check based off of the employees or by the course title. In some cases, we've seen where people want to look at all the records. They say, I want to see the index file that shows the actual report. And then I want to see all the certificates. And so that also becomes important when you talk about storing everything in one system, making sure that system has the ability to generate that within a couple clicks, as opposed to going into each employee's record, printing out individual files. It can become more cumbersome than storing them in paper files if you're not choosing the right digital management system that's specifically geared towards making those files and those certifications accessible.
And that actually brings up a very good point, is that, again, speaking as a surveyor, we have such a limited amount of time to do the survey and to look at those files. And it really behooves you to print those things and put them into the records, at least once a year, so that when the surveyor comes out, it's immediately available to them. It does get very frustrating when you have to tell them, oh, can you go online and print this information? And sometimes it might not be easy to access. So while the systems are great in being able to do the documentation, it's important to understand that you probably are quite frequently you're going to have to use that old-fashioned let's print and put it into the file mechanism to make sure that documentation is readily available to the surveyors that come out. Not all surveys, of course, are going to be scheduled. You could have a surprise survey when somebody comes in. The availability of that information readily within the file it makes things much more convenient.
John, and if you don't mind, I'd like to make one more comment on that. Something that is on our product roadmap internally, and I don't know any other learning management systems who've done this, but it may be interesting kind of to your point about when you have a surprise survey or even a scheduled one. There is something that I was recently in our development office last week, and there's something that is coming in our system specifically around complementing how to handle surveys. And literally, we're putting a survey button in our system that allows for an administrator to do a single button click and either print records, total records by all staff or by a list of employees. And it will kind of shoot that out of the system in a stacked way with an index. Here's the policies, here's the training records by employee, and making it easily sortable. Yeah, it will generate a rather large document. Right. But if you were to run that once a quarter and then update your paper records, it would be a really easy way to do that without having to go in and have to create a meaningful approach or plan before you even get started at printing your records. And I think that, to my point, it's not really just about our system, but really about choosing the right provider. A general industry learning management system may not be putting meaningful thought into what healthcare needs. And so choosing the right company to participate with when it comes to your learning is going to be equally as important as just implementing that online program and making sure that it's effective.
So, Steve, there's a lot of learning management systems out there, and I think it's very important that our listeners understand that you really need to have a learning management system that is going to be focused on healthcare, correct?
That is our mindset over at Medtrainer, yes. A really easy way to think about this is, let's think about fire safety or even slips, trips, and falls. Like if you were to think about these types of trainings, the dangers and hazards that you're going to face, and this is from the mandatory training kind of perspective, the dangers and hazards that you would face that you would need to think about for fire safety or slips, trips, and falls in a ambulatory surgery center are going to be quite different than on a construction site. I think everyone would agree with that. What do you do if there's a fire and you have a patient opened up on the table? There are very specific things that we're going to have to think about that are going to look different than what do you do if there's a fire and you are in a job function inside of a warehouse. Now, they may be equally as dangerous, but nonetheless, we need to speak to the job function and the role and the procedures that are going to be wrapped around them and how to handle those types of situations. So that's probably the primary focus. Number one is going to be looking to the content, making sure that you are getting the correct content for your segment of the market. And in the ambulatory surgical space, like Medtrainer, we have a 20-course curriculum that's specifically for ASCs. I think it's important that we look at ASCs as kind of even a different segment within healthcare, which is going to require finer tooth comb speak as we start to look through the content and make sure that it's applicable to our job functions and our job roles. Whereas the second kind of part was going to be the system itself, looking to utilize systems that are specifically designed and have meaningful thought put into functionality through the lens of a healthcare provider, a healthcare employee. There are differentiators that are going to be seen, even with regards to reporting, when and how to produce certain reports, how we're going to store things, what type of certifications and credentials need to be managed, what type of reminders and what type of automated processes we deploy through the system that are going to be more healthcare specific. And that's part of that journey when you're approaching what type of online system to utilize and really scrubbing down what's in the market. There's several of us in the market that do it very well. And there's over 500 learning management systems in existence today. And there's probably only 4 or 5 of us that really accomplish the approach to healthcare well.
So, Steve, there's certain types of education that just can't be done online, and we probably better talk about that because some education is just going to have to be done in person, or it's going to have to be very specific to the organization. And one of the challenges that I find is that sometimes when I go in and survey, organizations say, "Oh, don't worry, I got everything done. I do it all online," and then I go in there and I see that they're just using plain vanilla educational programs that have been developed by organizations such as Medtrainer without any modification. And of course, that's a challenge. Can you talk a little bit about that?
Yeah, from the administrator's perspective, the biggest problem we see is that a lot of times the administrators don't go through the trainings they're assigning themselves. I would start there.
Yeah, that's a very good point.
I would start there, and we make that recommendation, whether the training they are assigning is applicable to their job function or not. Combing through that training to make sure that they don't need to complement that with maybe some type of policy, procedure, additional training, or some type of customization is a really good place to start. And once we have kind of our list of the where to start, and we may come across trainings that we want to customize, most learning management systems will give you a way to upload a specific additional content. So if the administrator has content that's going to be specific to their organization, they can probably upload a PowerPoint or something to help offset the training or include the specifics that are needed for their organization. Now, when you come across trainings that are not going to be completed online, let's use like a CPR or ACLS, BLS type training that has a practical skill assessment. You can often kind of do a hybrid, so accomplish some of it online, but the skill assessment component still needs to be done in person. Actually, BLS is a really good place to start and have this conversation. So let's imagine an organization that has 50 employees and they have 10% turnover throughout the year. So you're replacing 5 employees per year. And we need to have everybody trained on basic life support. Those individual turnovers are going to, if we look at it from a timing perspective and an overall management perspective, are essentially going to require 4-hour trainings. So 20 hours worth of training across those people that would have to be done. The way that most people handle that is to bring in a CPR trainer who is a certified skill assessor. They'll do the 4-hour training, do the skill assessment on site. We're seeing that start to migrate away to be more of a blended solution where the training itself can be accomplished online, and then somebody within the org is a trained and certified skill assessor. And let's say in that particular organization, maybe every Monday or every other Monday at 8 a.m., there's a skill assessment that happens in this conference room. And the skill assessor shows up, nobody's there. Okay, they go on with their day. If somebody's there, they do the skill assessment, which takes 5 minutes. And now that organization has recaptured a tremendous amount of time with regards to, and actual real hard costs are saved from hiring trainers that have to spend those 4 hours for each individual employee, unless the employees, multiple ones started at the same time. But looking for ways to blend online and offline training, it used to be very bifurcated, where now it's really starting to become more blended together. Anything else that has to be done specifically offline, let's say an advanced type training for a provider that happens at some type of a conference or seminar or workshop, we're still maintaining those records. And this is back to our earlier point in today's conversation, utilizing your learning platform as a document management system and really making sure that you're capturing those types of trainings and the certifications that come with them inside of the learning management system can come back to that single record, single source of truth when it comes to the training records, and it should be a best practice to really be capturing those documents and those certifications for offline trainings. And then the third point to this is going to be accomplishing things that may need to be done in person. Making sure that if you're utilizing a learning management system, that there is a way to manage live trainings. Many of the systems out there, including ours, have we call ours a live training calendar. Other people call them virtual classrooms. It allows for our administrators to schedule trainings within the organization at a certain date, a certain time. They can usually attach or upload files or workbooks, let the learners know what's going to be necessary to bring to that training. They can limit the capacity and how many people can attend the training, wait lists, things like that. In larger organizations, it's a very, very popular tool. But when you do need to accomplish those types of trainings, it's important that if you want to keep all those records together, to utilize a system that allows for you to create those digital classrooms and thus creating the record at the same time. And once the training is taken, attaching the record, whether it's a roll sheet or whether it's a actual certification that's given out into the system, it can be really, really powerful to keep all of those offline trainings now online records.
And I do need to point out, all of our listeners, of course, have to be mindful of certain regulations, such as bloodborne pathogen training requires you to have a question and answer period afterwards. So that obviously is something that's going to have to be done, not online, but it's going to have to be accomplished in person. Likewise, sexual harassment training has that same requirement in most states that have that type of requirement. And for the emergency preparedness, we're all familiar. Hopefully, all of our listeners are familiar with all the changes in the emergency preparedness regulations, which will require considerable specificity. So if you're not uploading that content into the learning management system, as Steve has explained, then you're going to have to do that offline, because your education and emergency preparedness has to be very specific to your organization.
And to that point too, there's no system in the world that's going to accomplish 100% of every requirement for any one particular office, right? It's just
that's absolutely right.
Not possible. Utilizing online learning, the real goal is to save time, create higher levels of efficiency, and manage records within your organization in a way that they're more easily able to be obtained. But in no way, shape, or form would I recommend that any organization ever says, now adopted this training program, and now we don't have to worry about our training anymore.
That's right.
It's not that simple.
Yeah, absolutely. And that brings me to the last question, really, and kind of a fascinating topic in my view is, does online education really save you time? And I guess the answer is, of course, what are you doing now compared to what you should be doing? Yeah.
So to create just kind of a T-chart versus the in-person aspect versus online, I really do believe that online has a great value proposition for saving time. I know that we had previously spoke about on this call, and I had mentioned kind of the 5 employees turning over on CPR training. That example alone would be a tremendous time saver to the organization. But it really is going to come down to making sure that you have an effective online plan, and making sure that you're not going to just implement a system, assign some trainings arbitrarily, and hope that they get done. It's a little bit more focused than that. And when you put the focus and really frame out your learning plan and include online as part of that learning plan, that's when it can be effective. Is having a new hire orientation day with a real live person going to use tremendously more time than, let's say, doing it online? Probably not. But what about doing a training, especially for the organizations that say, well, and this is kind of the online versus online argument, and we hear this a lot. Imagine the ASC saying, well, we do all of our training. We have a consultant that comes in. We shut down the office for a day, and we just do the training on Tuesday. Everybody comes in. Well, that causes a couple problems. What if somebody's not there? 1, but 2, what are the soft cost implications to your organization for shutting your business down for a day? And that's where there's really this giant opportunity loss, where online training becomes kind of a great tool to scale and flex outside of organization time that is needed for running your day-to-day business.
Right, recapturing time that otherwise would be downtime anyway, because not every surgery center is busy all the time. So if you can do an online education program when people, at the end of a day, when you're going to pay for them to be there for the next couple hours anyway for guaranteed, if they have a guarantee as a certain number of hours, that's definitely recapturing time that would have been lost anyway.
Yeah, and I think just to really bring the whole view of it 360 is, does it save time? And we believe it does. It creates efficiency, but more importantly, the standardization of content is probably the most important factor there, I think. If you were to watch the same person give a presentation at a conference at 5 different conferences, and it's the same material, you're really looking at 5 different presentations. There's going to be different Q&A sessions. There's going to be different tangents that they get off on during their presentation, which may be beneficial, but some groups might miss out on things that were really positive to hear at one conference that only got presented another. And so the standardization of the education, the holding of information in one source of truth, right? I've said that a couple times, and that's probably one of the other really important things. And the overall flexibility and scalability, I think, is where you find all those factors together create that meaningful use case for adding an online educational program to your overall learning curriculum and learning plan within the ASC.
Thanks, Steve. This has been fantastic. I really appreciate your time.
Likewise, John, thanks for having me. I look forward to hopefully speaking with you guys at some point in the future again. Thanks a lot.
Sounds good. Thank you. So again, I want to thank Steve Gallion for that wonderful interview. Let's take a short break, and we'll come back and talk about upcoming events.
You are never alone in the ASC industry. Many organizations are eager to provide an opportunity to keep up on all aspects of running an ASC, and in this section, we highlight upcoming events.
If you would like your event to be included in the podcast, please send the event information to info@ascpodcast.com.
As one of the most sought-after speakers in the industry, John is available to speak at your state or national meeting, and the ASC Podcast with John Goehle can record an episode from your meeting.
So the next AAHC Achieving Accreditation program, which is an interactive, in-depth 2-day seminar designed to help organizations prepare for a AAHC survey, is March 13th and 14th in Miami, Florida.
ASCA 2020 Winter Seminars in New Orleans, Louisiana is January 16th through the 18th. The seminar features 3 ASC-specific tracks: Finance and Accounting, Coding and Reimbursement, and ASC Management. John will be speaking in the Finance and Accounting track.
Yes, and I actually have a hotel and an airplane reservation now.
Just got that today.
Yes, unfortunately, I had some problems with the hotel, but that's all taken care of. The first ASC Nurse Leadership Conference presented by Progressive Surgical Solutions will be Thursday, February 6th and Friday, February 7th, 2020 at the McKesson headquarters in Dallas, Texas. Ambulatory Healthcare Strategies is a proud sponsor of the event, and we hope to record a special episode from there.
The AORN Global Surgical Conference in Anaheim, California is March 28th through April 1st. We'll be attending the conference and recording a special episode there.
The Florida Society of ASC's Quality and Risk Management Conference is April 16th through 17th, 2020 in Buena Vista, Florida.
The Iowa Association of ASC's 12th Annual Education Conference is April 17th and 18th, 2020 in Johnston, Iowa.
ASCA 2020 is in Orlando, Florida, May 13th through the 16th. It is the ASC industry's most highly regarded and well-attended event. Attendees include physicians, administrators, nurses, managers, and owners of ASCs from across the country and throughout the world. At this conference, you will find more than 50 educational sessions designed for ASC professionals at every level, nationally recognized ASC management experts, networking opportunities with more than 1,000 of your colleagues, hundreds of exhibitors who can help you find the solutions your ASC is looking for, and the latest regulatory and accreditation updates. So make sure you sign up to attend by going to the ASCassociation.org website.
Becker's 18th Annual Future of Spine and the Spine, Orthopedic, and Pain Management-driven ASC Conference is June 18th through the 20th, 2020 at the Swiss Hotel Chicago in Chicago, Illinois.
And the Florida Society of ASC's annual conference and trade show is July 15th through the 17th at the Walt Disney World in Orlando, Florida.
Well, that's it for this episode of the ASC Podcast with John Goehle. Join us again, and please consider becoming a patron by going to our website at ascpodcast.com and spread the word about our podcast with your friends and colleagues, and do us the honor of hitting the subscribe button.
This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. We would like to thank this week's sponsor, Medtrainer, one of the nation's leading providers of online education. For more information, please visit medtrainer.com. If you are interested in advertising or sponsoring with the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We'd love to hear your questions and comments. Please email us at comments@ascpodcast.com.